Hi, I'm David Merritt, Vice President and National Policy Director at the Center for Health Transformation. Think for a moment about how you're watching this video. Most are probably online on the web, maybe you're using a cell phone or an iPod or some other sort of gadget. The important point is that these powerful, exciting technologies are second nature and are critical aspects of our everyday lives. Now think about the health system, the largest, most important sector of our society, and you're handed a pen, a clipboard, and see row upon row of paper medical records. Fortunately, things are changing. Over the past few years, we've seen a lot of progress in moving healthcare into the 21st century using health information technology. Health IT saves lives and saves money. That's why tens of billions of dollars were invested in the economic stimulus package to incentivize doctors and providers to adopt and use modern technology like electronic health records. We at the Center for Health Transformation are pleased to announce the release of our new book, Paper Kills 2.0, which explores many of the issues that are bringing healthcare into the 21st century, from open source software, innovation, clinical research, patient-centered medical home. With us to discuss this are the two co-authors to the foreword of the book, former Senate Majority Leader Tom Daschle and former Speaker of the House and founder of the Center for Health Transformation, Newt Gingrich. Senator Daschle, thank you so much for being with us today and for your partnership in moving this important issue forward.
Thank you, David. Congratulations on the publication of the new book.
Thank you. You've been a vocal leader on transforming health and through health reform, including your best-selling book, Critical, and your work at the Bipartisan Policy Center. What is your view on the role that health IT will play in actually transforming the system?
Well, I think we start with a couple of realizations. One of the realizations is that you can't fix what you can't see. And we don't have the level of transparency in our health system and our health marketplace that we need to be able to address the many, many challenges we face today. Nothing is more key to better transparency than HIT. The second real problem we have is that through administration, we recognize that in many respects, we have a 21st century operating room, but we have a 19th century administrative room. We need to bring the administration of our health marketplace into the 21st century. Nothing will do it better, faster, more successfully than HIT. In a sense, if we're going to create a new marketplace and a new health sector, the key, the backbone, the real spinal system of that new marketplace has to be health information technology.
Newt, what are your thoughts?
Well, I think part of what Senator Daschle just said is so central to where we are that the people need to really listen carefully to what he said. Without easy-to-access information in an electronic format, you can never surface the information you need. And I think this is really important to understand. Every place we look that has quality, where people are very, very productive, we have good data. We know what's happening. We're able to track it. But when you walk into a system that is very distributed with paper, and you really don't know, if I end up in a hospital with a paper-based record, and I go to a different hospital, they don't know what my allergies are, they don't know what drugs I'm taking, they don't know what's already been done to me. And as a result, you really increase both the risk of bad outcomes and you increase the waste of resources because people just don't know. So I think Senator Daschle put his finger on it. One of the keys to transforming the system is to make transparent the information flow so you can have both accurate health care and you can have an ability to know what works and what doesn't and to migrate people to what works.
Newt, we've seen a lot of progress over the last few years. And I think we're on the cusp of some enormous changes. But what do you see over the next 5 or 10 years that can actually get us over that hump and to build such a system?
You know, I felt the other week that I was at the cutting edge of the future when I was at Intermountain Health in Salt Lake City, which is one of the most advanced systems in the country at using information technology and has in Brent James maybe the most sophisticated student of health information technology in the world. And they have a very powerful project underway in which they are really trying to develop a very clear, personalized information system that allows them to bring the best of modern knowledge, including what we're learning in terms of genetics and the Human Genome Project, to the best of modern therapies and apply it directly to you in an organized way that allows them as a system to continuously improve what they're doing. And it's fascinating to watch. Somebody estimated at the Dartmouth Health Atlas that if all healthcare in America were as effective as Intermountain, you would reduce the cost of Medicare by 50% while improving the outcomes. And I felt like I was seeing, sort of peering over the edge of the future, which is why the chapter they have in Paper Kills 2.0 is so fascinating, because they're really visionaries applying that vision to actually run a very big health system in a way that I found very exciting.
You've done a lot of work with Mayo Clinic, who's doing a lot of the same work. What do you think is going to happen over the next 5 or 10 years to build this system?
Well, I just building on what Newt just noted, I think it's really important that the Mayos and the Intermountains and the Geisingers are not the isolated examples of success stories that don't represent the mainstream. What we want is for the mainstream to catch up with the Intermountains and the Geisingers and Mayos, and IT in a large context can do exactly that. What does it mean? It means better efforts at cost containment, better opportunities to improve quality, new opportunities for transparency, a recognition that innovation could explode if we had the technological applications that we're already beginning to see at some of our finer institutions, new models of healthcare that are only dreams in the minds of these visionaries today, but could be the reality in the future. That's what this is about, and that's really what is exciting about your book. It lays out that vision in a very tangible way.
Well, thank you for joining us. Thank you for your partnership, and thank you for the bipartisan leadership on this issue. Paper Kills 2.0. It shows how health IT is saving lives and saving money today. It also shows a glimpse of a future that is right around the corner. But most importantly, it shows us how to get there. Paper Kills 2.0, it's available now at healthtransformation.net.